title of my presentation is The Folly of Health Insurance Mandates. Just under 85% of the U.S. population currently has health coverage. This proportion has changed little over the last 15 years. For example, according to the Census Bureau, in 2007, about 15.3% of the population was uninsured. The same percentage as was uninsured in 1993. Of the 46 million people that currently lack health coverage in the U.S., if you were to ask them why they're uninsured, many of them would say because health insurance is not affordable, or because I couldn't get it through my job, or that it's just not worth the amount of money that it costs. But if you look at the Census Bureau data, nearly 30% of the uninsured already qualify for public coverage but are not enrolled. 40% of the uninsured live in households earning more than $50,000 per year, half of which earn more than $75,000 per year. Surely some of this group could afford coverage if they wanted it badly enough. The remaining segment, those earning between, say, household income between $25,000 and $50,000 per year, it's argued that a lot of those might be induced by coverage if they had a tax credit. It's statistics like these that is the reason why a lot of progressive politicians, why public health advocates, and those pining for universal coverage argue that we need an individual mandate. And they also argue that employers should subsidize much of its cost. And of course, as when you have these regulations, you must include other regulations, they argue, that would force insurers to cover all that apply at rates that are tightly banded together. They would also expand public coverage because obviously if you require moderate income folks to have coverage, taxpayers will have to help cover the cost. Of course, there are some problems with all these arguments. First off, an individual mandate that would compel all Americans to have health coverage would be very difficult to enforce. For example, all but 3 states already have mandates that people must have auto liability coverage. But yet, if you look at all those states, you'll find the proportion of people who lack auto coverage is almost identical to the proportion of people that lack health coverage. It may well be the same people. This doesn't make health coverage more affordable. In fact, it just shifts cost across more people. It also invites special interests who will descend on the state capitals or Congress to lobby to make sure their respective service, their provider group, or the disease they're advocating for is covered by the mandate. Across the U.S., all 50 states, there are more than 2,000 mandates currently. And although the advocates for specific diseases or providers will often argue that their mandate costs little, they all add up. And in fact, various research has found that about a quarter of the insured may have been priced out of the market. Research at the University of Minnesota estimates that if people could go across state lines and purchase coverage in states that are less regulated, that they might it would insure about 12 million additional people. The problem with an employer mandate is that whether or not your employer offers health coverage is really a function of how badly workers want coverage. If an employer offers coverage, it's generally because the workers are willing to forego an equivalent amount of cash wages in their take-home pay to cover health insurance. To the extent that you force employers to provide health coverage that workers are unwilling to pay for indirectly through wage reductions, it becomes a tax on labor that would inhibit job growth. And I would argue that being unemployed is a bigger concern to a lot of people than being without health coverage. It's oftentimes argued that if we have an individual mandate, if you compel individuals to have coverage, that you should also compel insurance companies to accept all that apply at rates that are tightly banded together. This so-called guaranteed issue and community rating means that those that are younger and healthier tend to subsidize those that are older and sicker. But this tends to raise premiums, and there's roughly 6 states that have variations of these regulations. And in many of these states, the cost of premiums tends to be 2 to 3 times as high as those states that do not have these regulations. If insurers must cover all that apply, that provides the incentive for people to wait until they're sick before they get insurance, because there's no penalty for doing so. And if we have an individual mandate, that also compels low-income and moderate-income families to have coverage as well. And since moderate-income and low-income families most likely cannot afford the extravagant cost of many of these plans that would be foisted upon them, it means that taxpayers will have to meet the bill and pay for these costs at rates that are much, much greater than the current cost of Medicare, or Medicaid, and S-chip. Also, some of the arguments have been that, well, if we need to have affordable coverage for low and moderate income people, or those that are not offered coverage through work, why don't we have a public plan that would be free of all the obligations that private insurers must bear, that would not have the reserve requirements or pay the taxes, the income taxes, property taxes, payroll tax, and could pay Medicare type rates. Well, if you had a plan that was free of all the responsibilities that private insurers are obligated to pay for, and if that plan had the power of law to set price controls on physician reimbursements that run about 20 to 30% lower than what private insurers pay, according to the Lewin Group, such a plan could undercut private insurers to the extent that over time it would likely crowd out all private or most of private coverage. For example, if you had a public plan of this nature, the Lewin Group estimates that approximately maybe up to 31 million people would either be dropped or jumped from, pushed out of their private coverage into a public plan. When you add these numbers to Medicaid, Medicare, S-chip, you have a market segment that literally a takeover of healthcare that would approximate 75 to 80% of the market. It's doubtful that a private industry would maintain their negotiating power such they would probably over time be reduced and go out of business. Also, if you have an individual mandate, that means some governmental body, some authority must have the power to decide when that mandate is met. For example, in Massachusetts, it's the Commonwealth Connector. When you're referring to the employer mandate in Hawaii, there's a similar board. These boards tend to be stocked with special interest groups, representatives for unions, provider groups, hospital associations, and other entities that tend to favor comprehensive coverage that with low cost sharing, little out-of-pocket payments, and high lifetime caps. In other words, they favor comprehensive plans that are very costly and very lavish and far more expensive than many people would prefer to own. So I really don't see having mandates as a way to have affordable coverage, as it's often claimed. Rather, I think it would increase the cost of coverage to the extent that few of us could afford health